If there is one thing I have often heard in my last 12 years of teaching and training oncology residents, it is that oncology residency is hard. I hear oncology residents complaining all the time that residency is tough. The syllabus is just impossible to finish. I need to know anatomy, radiology, surgery, radiation, chemo, immuno. Nothing was taught about oncology in MBBS course. But let me tell you a secret today. Oncology is not hard. It is just that it is taught in unstructured way. Unstructured way. If you try to mug up an oncology chapter from textbook without understanding the logic behind the treatment, yes, it will feel hard. But if you read it in a structured way, meaning you know what to read, how to read, and more importantly, what to ignore, then oncology becomes simple. And that is exactly why I started this channel. Hello everyone. Welcome to my YouTube channel, Oncology for Residents. I am Dr. Parveen Ahlawat. I am a consultant at Rajiv Gandhi Cancer Institute and Research Center, New Delhi for over 12 years. I have been practicing and teaching oncology for over a decade. My journey in oncology began at one of the finest institutes in the country, CMC Vellore, where I completed my MBBS and DMRT. I later did DNB from Rajiv Gandhi Cancer Institute and Research Center, New Delhi. I did a fellowship at Royal Marsden Hospital in London. I also did a specialized training in cyberknife from the USA. I am a researcher at heart with over 85 publications and abstracts in international journals. But is this my true passion? No. My true passion is teaching. I have spent my career mentoring oncology residents, helping them navigate everything from their thesis to their final exams and viva. Over the last 12 years, I have been directly involved in exam process of DNB. Theory exams, practicals, case discussions, OSCE and vivas. I have sat right next to the senior most examiners in the country, the very professor who are likely to be your examiners in the future. I have watched them grilling residents. I have seen brilliant students fail simply because they mucked up theory well, but did not truly understand the oncological concept. They did not answer well about why was this specific treatment is more appropriate for this specific patient. I know exactly what the senior examiners want to hear from you. After these many years of sitting with senior examiners in exams, I truly believe that these examiners don't just want to check your oncology knowledge. They want to see safety and clinical logic in you. Safety and clinical logic in you. And if they don't find both of these, it is only then they fail students. Let me tell you another truth. Residency is not hard. The medicine itself is logical. The problem is the way you are reading it. The problem is the way you are trying to understand it. If you try to memorize textbook page by page, or if you try to mug up guidelines without understanding the logic behind the treatment, then yes, it will feel hard. It will feel impossible. But if you have a structured learning, if you know what to read, how to read, and more importantly, what to ignore, then trust me, oncology becomes simple. This is exactly why I started this YouTube channel, Oncology for Residents. I created this channel with one goal, to bridge the gap between what the textbook says and what you actually need to perform well in exams and your clinical practice. We all know that textbook can be vague, but in exams and in clinic, you need precise answer. I consider my DNB residents at my hospitals lucky. At RGCI, I have set up academic classes specifically for DNB 3 times a week. And no matter how busy the OPD is, how many patients are there in the ward, no class is ever cancelled. I prepare topics to be covered in these classes in such a way that everything in oncology is covered in 1 year time span. We do discussions and recently we have started doing panel discussions and quizzes and debates also in our classes. So by the time our DNB sits in exams, he must have finished at least 2 rounds of structured oncology classes. Now many of you might think, are these classes really helpful? I can read myself. You may ask, does this strict academic culture in RGCI translate into better outcomes? Absolutely yes. I'll give you evidence. We oncologists are fond of evidences. The evidence is very clear. Not only do most of our residents pass with flying colors, but let me share a fact with you. Over the last decade of the DNB course running across India in 3 out of 10 years, the DNB Gold Medalists for the entire country has come from RGCI. 3 out of 10. This can't be a coincidence. This is the biggest proof that structured learning and rigorous discussion actually work. The same culture exists in a handful of premier institutes like AIMS, TMH, CMC Vellore, PGI, and some more academic hospitals and medical colleges. But let us be honest, there are not many such centers. For the vast majority of DNB candidates across country, especially in private hospital, the reality is very different. And I'm going to be very blunt here. Blunt here in saying few things. I apologize upfront if any senior oncologist from private hospital is upset hearing me say this. But this is the hard reality. But this is the hard reality. I'm saying this based on direct feedback from residents across the country. Listen very carefully. In many of these private hospital setup, the intention is not to train or teach you. Their intention is not to produce the next generation of oncologists. The unspoken aim of this hospital is to get cheaper labor for 3 years. Their aim is to get 1 or 2 hardworking MBBS doctors for next 3 years who will quietly manage their wards doing the clerical work and keep the hospital running. Look, I'm not blaming the consultants and faculties in these hospitals. And to be very honest, the consultants or faculties in these private hospitals simply do not have time to teach you. Their primary aim is patient care, which has to convert to better patient satisfaction and thereby more revenue for the hospital. In that high pressure corporate environment, your learning is nowhere on the priority list of these hospitals. Whether you pass or fail makes absolutely no difference to these hospitals. Essentially, you are left alone. Some of you pass, some of you fail in exams. And this is exactly why I started this channel. Because if your hospital will not give you that structured level of teaching, I want to give my sincere effort to fulfill that gap. So guys, whether you are an oncology resident in surgery, radiation or medical, or a young oncologist just starting your practice, this channel is for you. Here is my plan. Every week, I will be uploading 1 or 2 high-yield videos. And once I get used to this YouTube online thing, I will upload 2 videos consistently. Hopefully, I will improve gradually and give you better content after few videos. We will take topics, break them down into structured way. I think we can start with head and neck cancer first. The commonest cancer in everyone's hospitals. So that will cover almost 50% of your patient's load, no matter which part of the country you are in. We will discuss everything in great detail. We will discuss not only radiation oncology aspect, we will also discuss surgical aspect, medical oncology aspect, that too in a sufficient detail so that all 3 specialties are covered. My goal here will be to give you direct, easy to understand evidence-based and guideline-driven content that will not only help you pass your exams, but also make you a better oncologist. No fluff. Just the content you need to pass exam and treat patient. We will also do clinical case discussions in between the lectures, and I will also show you live contouring for some common malignancies. The other thing I believe is there are these online platforms, Zoom, YouTube, Facebook. There is no reason, absolutely no reason why teaching and learning has to be done in a classroom setting. It can be done on online platform, though I personally feel that it is inferior to class teaching. But this is the only option we have if you want to cover large audience. Listen carefully, guys. Your residency years are the foundation of your entire career. Build that foundation strong. Stop memorizing. Start understanding. And let's get to work. I am Dr. Parveen Ahlawat. Let us decode oncology together.